From the plains to the rolling hills, Oklahoma is a state that resonates with stories of resilience, determination, and pride. Welcome to Inside the 1581, a podcast of the Oklahoma Hospital Association. Together, we'll dive deep into the heartbeat of the great state of Oklahoma as we journey through the rich history, diverse culture, and the ever-evolving landscape within the 1,581 miles of border in our nation's 20th largest state. Each episode of Inside the 1581 will feature conversations with the many voices which help shape our state's future and our shared vision of improving health and healthcare in Oklahoma.
Thank you for joining us for another edition of Inside the 1581. I'm Rich Rasmussen, President and CEO of the Oklahoma Hospital Association, and today we're talking all things cybersecurity. And I am delighted to have joining us today Mark Kirby, who is the supervisory advisor, am I correct? Supervisory cybersecurity advisor for Oklahoma and Arkansas. And folks, this is a long one. The Cybersecurity and Infrastructure Security Agency. I just call them, you guys, CISA.
Right. Well, and CISA is right. I've heard CISA and some other ones, but even my boss had to correct me after I was already employed and nudged me and said, "You're saying it wrong there, Mark." You know.
Well, and there's, as with everything, you talk about it in healthcare or you talk about in government. There's always an acronym. And so Mark helps state governments and critical infrastructure organizations like hospitals, fire departments, local governments, energy providers, all part of the critical infrastructure definition, strengthen their cybersecurity defenses and manage cyber risk. You're a retired Air Force veteran with more than 35 years of experience spanning military communications, Department of Defense network operations, cybersecurity leadership. That's a lot.
Fun stuff.
Well, Mark, thanks for joining us. I know we tried to get together, what was it, like last fall? I think there was may have been a government shutdown there in the middle someplace. And for folks that are listening, it's important to note that even when you do have shutdowns, critical agency functions like CISA continue. It's just some of the things you may do as part of a community outreach or education may not fit within the current scope at that time because you're focusing in on your core services.
Right, which is notifying, helping organizations understand, like if you're about to be compromised or are in the process of being compromised. We make those notifications all the time with here in Oklahoma and Arkansas and nationwide.
Well, we appreciate the work you guys do. I just wish I could get it to someone to stop calling me, asking me to refinance my house or something like that, and Alex is laughing here too because we all get them, right? Or the new one now is like, hey, we would like to buy your hospital association. We have $200 million ready to buy you. We get those all the time. It's an inside joke for it. But anyways, Mark, we're glad you're here. I think CISA is one of those agencies that we don't know a lot about, and I don't think we have a real appreciation for the impact that the agency has on all of our lives, particularly as it relates to the continuity of government and the overall continuity of our commercial operations and business. So why don't you walk us through, what CISA does, the total scope of your responsibility, so our listeners have a better understanding, and I would argue a better appreciation of what you guys do.
Okay, sure. CISA's process is huge. I mean, I didn't even know it, and I've worked for the government for all these years. But we were established. We're still what they consider one of the fairly new organizations in their Homeland Security. And
so that's under the Department of Homeland Security.
Yes, Department of Homeland Security. Yes, and so we tie cyber has really become the big thing, but it's actually been around a lot longer. They've been working on protective security or physical security of organizations. Right now we got FIFA going on. So the security advisors have been down there helping analyze the stadiums, identifying potential risk and threats for people going there. So that's one portion. We've got emergency communications coordinators. They work with like the 911 facilities and helping them understand their security and risk from potential, hey, do we have our resilience at the right level? Do we have what's our risk level? What kind of gaps do we have? And doing that. And then with the cyber side of the house where, I like to say I'm a nerd, is, hey, I'm trying to help organizations understand and see those risks that, hey, we've become so interconnected with everything. I mean, nothing can basically operate without access to a network
Right.
and information passing and all that information. But helping organizations understand what they need to control, when they need to control it, and potentially, you don't need to have control everything. You need to identify what your critical services are, what your gold nuggets are within your organization, and protect those, because those are what's most important. And then helping organizations understand what their dependencies are. So a lot of them, very good. I know it internal to my organization, what I'm dependent upon. But what happens if power was to be compromised, and that just happens to be the only energy cooperative in your rural location, and they lose power? How long is your generator power going to last? How long before it starts to impact your critical services? And so that's where we really help organizations do is what's your critical service? Do you have enough? Do you understand the risk that plays in your critical service? What happens if it goes down? And then what's your resiliency level? And so we spend a lot of time with helping educate organizations about that.
So if we looked at it, so would CISA not only do the critical infrastructure evaluation when it applies to cyber, but you also intervene at some point? And do you work with other federal agencies that if we see a bad actor out there that's trying to infiltrate, and let's use the healthcare system as an example, we've seen that, right? Mm-hmm. And do you guys step in at any point in that, or are you there that on the front end trying to educate the user, and on the back end, what did we learn from that experience in order to reduce the risk going forward?
Yes, so we're more on the proactive side.
Okay.
So once you've been hit, once you've identified that you've been compromised, whether you choose to report or not, and we always recommend report, because most likely if you're that small healthcare facility, you're not the only one that's currently experiencing a issue, right? We have the ability to send out notifications to other like-size organizations and say, hey, this is coming down. When it turns into a criminal or an investigative type of thing, that's where the FBI or your insurance or your legal steps in and kind of takes over from there. Because at the end of the day, we want, I'm an advocate of, hey, I want you to protect your reputation. You need to control your messaging. You need to understand how to control your messaging, number one, and number two, make the right decisions on what you need to tell so that you're not inadvertently getting yourself into trouble, so to speak.
Sure.
Yeah.
So let's talk about how this impacts hospitals, certainly, because we have seen it. We've had national denial of services. For our listeners, we have bad actors have the ability to essentially cut you off from your access to the internet.
Yep.
You have bad actors that have exploited some hole in your cybernet, and they've come in and they've shut systems down. Mm-hmm. We've seen that, and oftentimes those bad actors, may want to hold the organization hostage, saying, if you pay a ransom here, ransomware, right? Pay a ransom here, we'll give you your system back.
Right.
And if you don't pay your ransom, then we're going to do whatever. Mm-hmm. And we've seen that in healthcare, and I'm sure we've seen it in a lot of other fields too. But in that scenario, let's kind of walk through this a little bit for our listeners. If an organization, whether it's a physician practice or a hospital, you recognize that something is wrong, or your surveillance system has indicated that there's been a breach, or nothing works.
Right.
And now all of a sudden you're like, okay, what's going on? Nothing works. And then you get the notice that, we've taken over your system and here's what we're demanding of you.
Yep.
Kind of walk us through maybe what happens in that scenario. Some folks go through it and some will never go through it, thank goodness. Kind of walk us through what typically happens. It may not necessarily have to be healthcare, but any organization that could find themselves in that position.
Well, so a lot of times what we're seeing is, most organizations do a fairly good job protecting their front door. So the threat actors it's not as easy as it used to be. Not to say that a persistent threat won't spend the time and the effort to hopefully catch you in between a patch cycle. But what they've most likely done is compromise, either phishing or something like that. They've probably been sitting in your network for a while.
They're just waiting.
Yeah, just waiting.
The code has been inserted, and they just wait until there's a time that it works best for them, and you're asleep potentially.
Yep, that or they've learned it from one of your critical supply chain partners, right?
Okay.
They've actually gotten in through that vector, and so that's why it's really important to know who your supply chain partners are, who has access to your network, understanding what all your assets are within your network, what data you have flowing, and setting up a baseline for that. So the threat actor gets in there, they're sitting around. Maybe they figure it's time, right? This is a 0 day. We're gonna go ahead and hit them. We've gotten to we know exactly what to ask for, because most organizations keep their cyber insurance policy out on the network. I don't recommend that. I always recommend keep that in a safe somewhere.
I'm making a note of that one.
Yeah.
We actually own an insurance agency, so we help our hospitals with that. So I'm going to ask the rest of our folks that are on the risk team.
Yeah.
How do we do that? So that's a good one.
Yeah, well, and it being that, if they can get to that, they know exactly what to ask from a policy, because they know what's going to be paid. And
they probably are pushing for the policy limit. So if they know what the policy limit is, if you got a policy limit for $1 million, they're asking for $1 million.
Yep. Exactly. And then what would be the really scary thing is, let's say they get in and they pull down that critical information, patient health, patient social security numbers, their phone numbers, all that type of stuff. Well, we've gone beyond, the first order of effects, them attacking your network. You're going into the second order of effects, which is them starting to contact your patients and saying, "Hey, if you don't pay up, for $1,000, we won't release your personal information out there on the dark web or whatever." Because a lot of people. That's why we go to a doctor. That's why that doctor-patient privilege exists. So I'm talking to my doctor about stuff that I don't want other people, may not want other people to know. Right. So threat actors know that. So they're doing that. And it's a leverage factor for them. They're able to leverage the hospital saying, "Hey, do this or do this." And so you've been ransomware. Now you've got patients potentially being contacted by the threat actors, also being ransomed or being blackmailed. So ideally you have that cyber incident response plan. Right. And so an organization should have, "Hey, this is what we do if this was to happen." And within that, what you want to look at is, hey, who are the first people I contact? Ideally it's your IT folks or maybe your managed service provider, but you're taking a look at your insurance policy. There may be specific rules that you need to follow with that. Talking to your public affairs, if by chance something gets out, you want to already get ahead of that messaging, and then your legal advisor on what you can and can't say. And then at that point, it turns into the government's always going to recommend don't pay ransomware, but that's a business decision. And as you know, a lot of organizations, they can't afford, they're losing too much money a day, reputation risk, all that other type of stuff. So they decide to pay the ransomware and things, and then hopefully they get the threat actor out of their system. But once again, you're dealing with a person that just broke into your thing, and while they may act like a nice business person and tell you it's all back, it's like, would you really pay a thief, money to get your stolen car back and hope that they wouldn't never do it again?
I mean, it's a tough play too. Yeah. I've heard many presentations on this, and we go from what might be the release of health information to the potential super bad actor that might have access to your infusion pumps, your elevator control systems, your ventilation control systems, security systems, the controllers for your medical diagnostic equipment, your radiological equipment, all of those. And I think most folks don't realize how truly connected we are in healthcare. Many of our medical devices have access points and built such that we can take that data and can help us in being able to diagnose and provide treatment plans with folks. So there's great value in having the information that comes from them, but it does create the potential of, if that port hasn't been appropriately shut down or a software update comes in, you download the update and it opens a port back up that you closed. So I don't think we really appreciate all the great data we get, but at the same token, the hard job it is for those that are leading the security efforts in an organization because of all of that. And so I'd be curious, your thoughts. Is there just this genuine? And we'll get back in digging a little bit deeper in the challenges we have. But do you think there's a genuine appreciation that the public has when we talk about cybersecurity? And are there some misconceptions about that? Do they automatically think that it is someone's just disclosing information and not really understanding how far this goes in many instances, or how far it can go in terms of an intrusion.
Ooh. So,
Because I always think of the Terminator, right? I mean, that's everyone defaults to something. We're not talking about that, but we clearly are talking about that once a bad actor gets into the system, it's a race.
yes.
It's a race because they've already mapped your system. So now you're racing and you're going up against your VPN provider, who may be the result of the intrusion because they didn't patch something that they may or may not have known that needed to be patched. So you've got all of these external forces that you rely upon for your security. And to your point, in your supply chain, they may be the ones that created that risk for you.
I think one of the challenges is more that we expect. So to put it into like an analogy, right? I go to my primary care physician to talk to him about medical issues, right? I have a heart problem. He's not going to solve my heart problem for me, most likely. He's going to send me to a specialist, a cardiologist. And I think one of the big challenges is a lot of the smaller organizations, I won't say the bigger ones, I think the bigger ones actually get the picture, is that your IT guy, he may be a server guy, does not necessarily mean that he understands cybersecurity. And it's not a ding on him, but I think you have to look at cybersecurity as kind of like the holistic thing, right? You got to look at, I need a specialist that specializes in, policy and governance. I need a specialist that specializes in this new software. And I think a lot of times too, a lot of organizations get these vendors coming in, and once again, let me separate from, in my experience, the big boys and the smaller ones, is that they come in and say, I'm going to solve all your problems, right? And a lot of times they do have a really great solution, but there's a whole nother tail end of it that you kind of hit on was, now I got to train my IT guys. Not only do they need to understand this new system, we need to look at whatever, if we have an approved baseline configuration, what is that going to changes is that going to make? And then I've got to train these guys to be able to identify anomalies or differences in the system, and so I think there's a whole life cycle piece that you got to incorporate that into it. Is, hey, I also got to include the training and knowledge and understanding. I may need to actually hire a specialist that comes in and helps me write policy and governance on cybersecurity.
Well, and I think that's makes all the sense in the world. I mean, we have to take time to make sure we do this right as much as we can on the front end.
Yes.
As we do that. As I look at this issue, in healthcare, we tend to look at what are our best practices to improve outcomes, what are our best practices to reduce risk in surgical procedures and other healthcare delivery. I'm sure the same approach is used in how we attack our challenges as it relates to ensuring our cybersecurity. What do you, when you think about it, what are some of those best practices? The one thing that I think of immediately, and we do this in our organization, and I know many folks are, don't always like it. It's called two-factor authentication, right? So, you got to log in, and then you either have to use your authenticator app or a text message back to you to make sure it's you. But those are important. Yep. And so what are some of those best practices that any organization should be looking at as a baseline for protecting their organization?
Well, first off, with some of the healthcare organizations I've dealt with, first thing to do to get away from is a open username password. I've been to a couple hospitals where at the nursing station they want to have that everybody logs in with the same username and password. That username and password.
I like biometrics. That's why I use a MacBook. I use my fingerprint. It's perfect. That should be that way for everyone.
Yeah.
Some simple biometric, and I don't have to remember it.
Yep. There you go. And so one thing, if you're still, and I will be honest, I work with a healthcare facility up in the Tulsa area. I did a couple tabletop exercises with them, and because they were having a challenge. The IT department was having a challenge getting them off of the same username and passwords they'd had for 5, 10 longer years. And through the tabletop exercise, I showed them exactly how bad that was. And now they have multi-factor, and they have that change. But multi-factor is a great thing. I would offer one step above it is get away from just getting the text messaging and almost going towards an approved authenticator app that does that. But it also boils down to cost. What can you do? But I mean, at a minimum, I think you'd find out that not having a username and password or implementing multi-factor is a lot cheaper across an organization than just sticking with the username and password and getting compromised. I think you'll find a good return on investment with the multi-factor. I think also, I kind of hinted on it earlier, is digital visibility, which means understanding everything that's on your network. If you don't know what all your assets are on your network, and that includes people, information, technology, facilities, and how your information is flowing, how can you do an adequate job of securing it? If there's some ancient switch or some ancient server still up and operational, which organizations still find from time to time after we talk and we do an assessment with them, and they're like, oh, hey, we didn't know we had this thing running, and it's got a public-facing IP, and the threat actors could have gone into it. So really doing that, and then doing your patching, right? I mean, staying on top of your patching. And I understand, organizations need to have it, but when a critical vulnerability comes out, there should be a process in place for the IT department, whoever's getting these vulnerability reports and vulnerability statuses, to report up and say, hey, boss, this is a really key one. Instead of, maybe it's once a month we do patching, we probably need to patch this thing in the next
real time,
3 to 5 days or whatever. But at the same time, healthcare is a little unique, right? You're dealing with people's lives. We've got like 5 open heart. I don't know, I'm not a doctor, right? But you know what I'm getting at. You got 5 surgeries that somebody's life impacts on it. Okay, well, can't do it, but I would definitely have a plan to say, if we were to be compromised during the middle of this, how are we going to react? What are our steps to go manual operations that we no longer have that ability? And even going one step, I've started to think about, they're talking about the robotics doing this type of stuff. Well, what happens if the robots, compromise?
Sure. Those are real risks. Yeah, those are absolutely right. Yeah. Well, we're going to continue this conversation when we come back after this break from our team and our partners at Forefront Healthcare, who make it possible for us to deliver our podcast inside the 1581. We'll be right back.
Are you looking to elevate your facility's support services? Forefront Healthcare is a leading provider of food, environmental services, and facility management solutions to hospitals nationwide. Recently recognized in 2023 as a top 100 best places to work by Modern Healthcare magazine, our comprehensive boutique approach ensures measurable clinical outcomes tailored to your facility. Elevate your facility's patient, staff, and family experience today by visiting forefronthealthcare.com or call 800-684-6450.